Good morning, everybody. Can you hear me? We are live. It's been a while since we've had everybody on.
Did you let me in, Troy? Because I can't.
You're in.
Okay.
You're already in. You're actually on the screen, but your camera's not on.
I know I was looking what's going on.
Yeah, it's we haven't done it in so long. It's like we're kind of out of touch with how things are supposed to go. Now that everybody's back to work and we're trying to move forward.
I don't know what's going on. It won't come on.
Well, something's happening right now. I don't know what you just did. Is your camera covered on your computer?
Huh?
On the top of your computer, there might be a little switch that closes the camera. A little toggle switch.
No.
No? Yep, there it is. There you are. You have something covering the camera. Oh, what it is that your computer is actually on the computer camera and not the webcam that's up there. You need to switch the camera. Here, let me come and do it for you. Hold on.
Usually it's just on this one.
Curry to the rescue.
I just sent a new email. Okay. There you are, Claudia. You're there.
Okay.
You're on the wrong camera, but you're there. As long as we can see you is all that matters. We're just trying to get Thelma connected. She the invite didn't go through the way it was supposed to apparently, so um, she can't get on. Oh, so my computer is still sending, so it might still be in the outbox. Well, either way, as we're getting Thelma connected, I'm going to get started here. Good morning, everybody. Thank you all for joining in to assist with this update for the community. You guys want to, again, for those who may not have been on before, introduce yourselves and let people know who you are and what you do for the department.
Good morning. My name's Claudia Lenti. I work for the CHR program. I'm CHR generalist for HHS. Thank you.
Hello, my name is LaDawn, and I am the Tribal Public Health Educator here at San Ildefonso.
And Darylyn.
Morning, I'm Darylyn Martinez. I'm the CHW for COVID-19 here at the HHS department.
Thank you very much. And it looks like Thelma just jumped in. She's outside sitting next to the big tree. Go ahead and introduce yourself, Thelma, and then we can get started.
Welcome, Thelma Gonzalez. I work with the CHR program here in Sanai. Hope everybody's doing well.
Thank you. Thank you. And my name is Troy. I'm the Director of Health and Human Services, and I believe everyone on this call is part of the COVID response team. So we're going to start with a COVID update to just get everybody back on the same page and understanding where we are with regard to COVID within the Pueblo numbers, situations that are going on, news updates that might be relevant, and questions that you all might have. If you have questions or comments, the comment section is always open for you. You can leave comments or questions in that little box, and we can either answer them live as we are on the broadcast right now, or if you are watching this later on, or if you're on live and you'd like to just put something in the comment section or questions that you want us to answer later on because it comes up later on, we can do that as well. We always go back and check those comments and questions later on and respond as appropriate. So here we go. We get started. Today's date, August 25th. Time is 11:17 a.m. So here are our numbers, and these numbers look good compared to where we have been. We do only have one active case. With in the past 7 days, there's only been 2 cases, so that's pretty good because we were averaging a couple of cases a day there for a second, and we were averaging 3 active cases for quite some time, and now we're actually down. Well, yesterday we were at 0, and then for about 3 hours, and then we got a new case. So we have 1 active case, and that brings our case count up to, since the beginning of the pandemic, we are now over 300 cases, 302 total, with 299 recovered cases. The reduction in numbers and cases is similar to that we're seeing in the state of New Mexico in general. As you can see, looking at the top and the bottom of the state of New Mexico map from the New Mexico Department of Health COVID-19 dashboard, you see that there are some counties that are no longer in red. They are actually reducing. The numbers are reducing across the state, meaning the average community spread of the virus is reducing overall in some counties, including some of our neighboring counties to the north. And so hopefully this is a good sign showing that the case numbers and the virus itself are going to continue to decrease, and that the issues regarding transmission within the community start to fade. It looks like, I have to say, Thelma just notified that there is another case. So technically, we have 2 active cases now instead of 1. So you see how it changes quite frequently. Sometimes we are in here talking about COVID cases and trying to figure out what our next best steps are, and then we get another call. The COVID line is ringing, or somebody's showing up at the front door, ringing the doorbell, saying, "I want to get tested," and then we have another positive. But luckily, it's still staying at lower numbers. 2 cases is a lot better than we had double digit cases here a few weeks ago. So um, that's good. Um, so with that regard to COVID, there are some newsworthy announcements to make that the community might want to take into consideration, and most of it is around vaccinations. And so we've talked a lot about on these broadcasts about the upcoming um, adjustments in the COVID-19 vaccination makeup that is going to try to get us to a point where we are better able to fight the most recent subvariants of COVID-19, which is the Omicron variant. It has stayed around for quite some time now. The Omicron, so it's not mutating to the point where it is becoming a new variant itself. We're just getting a bunch of subvariants inside of Omicron. So just slight mutations within the same variant. And so the reason why I'm saying that is because the breakthrough cases that have been uh, becoming more common lately, um, regarding those folks who are vaccinated or have been previously infected, is it's most of that is because the protections that the current vaccine has against COVID-19 it was designed, or they were designed around the original strain of COVID-19. So as uh, the virus continues to mutate from alpha to beta to gamma to delta, all the different variants that have come along since the beginning of the pandemic, the vaccine has a lot less um, effect when it comes to preventing COVID-19 infection, as well as protecting against serious illness. So Omicron looks like it's been around for quite some time and is mutating within itself as opposed to becoming a new variant. So they decided to design a vaccine formula to address the Omicron variant, which is what's going to be coming out in the next couple of weeks. They're looking at somewhere around the second or third week of September. The Omicron specific, they call it a bivalent um, vaccination because it has the original vaccine formula in it, as well as the vaccine formula for the BA.5 and the BA.4 Omicron subvariants. So within the next few weeks, you're probably going to be hearing from us talking about let's get everybody scheduled to get a booster, because this is the booster that everybody was waiting for. Some folks who got the original vaccine series, the first and second of the Pfizer and Moderna, and then they maybe got the first booster, and then they've been kind of saying, well, why get boosters if people are getting COVID anyway, and people that are vaccinated are still getting COVID. Um, First of all, vaccines were never designed to stop us from getting COVID. They were designed to stop us from dying and getting really sick from COVID. But in the beginning, when the vaccines first came out, it was effective against stopping from symptomatic people getting symptomatic COVID. They weren't getting it at all. But throughout the mutations, we've known that the effectiveness is a lot less. And now, because of Omicron being a much more contagious subvariant of, they're saying that BA.4 and BA.5 are the most contagious of all the variants since the beginning of the pandemic. So that's why the new vaccine, the new vaccine booster is going to address that specific, those two specific subvariants. So when you get those boosters, the likelihood of you being um, getting COVID or having symptomatic COVID is going to decrease, because it is more relevant to what's going around now in the COVID-19's subvariants that exist currently in the country. So I know that's a lot of just me talking about the history and how we got up to this point, but I just wanted to make sure people understood that when we're talking about um, encouraging members of the community to get boosters, this is not just your regular COVID-19 booster. We're asking about um, folks to get the booster that is specific to what's out now, and it's going to provide you a lot more protection than the previous version of the COVID-19 vaccine. Now, in the next 3 weeks, vaccine that vaccine version is only going to be the Pfizer. Lost signal. Sorry, I just unplugged the Ethernet cord somehow, and I lost signal for about 3 seconds. Um, the Pfizer version of the vaccine is going to be the only one that's available, and it's going to be available for those individuals 12 and up. At least that's what they're hoping. At minimum 18 and up, but it should be available for the 12 to 17 and the 18 and up. But then they're looking at October for Moderna to also release their version of the bivalent formula that includes the BA4 and BA5 um, Omicron variant protection. So I just wanted to make sure that that was out there, because you will probably hear from folks like Darylyn and Claudia and Thelma and Raylene once we start trying to communicate with folks, trying to get them scheduled or set up to get vaccinations. We do anticipate having a vaccination clinic here at the Pueblo. After talking to the New Mexico Department of Health, they are willing to come out and provide us a clinic as long as we get enough people to sign up. So it's important, if you are considering or interested in getting a booster shot, or if you've never been vaccinated before, including your 6 month to 4 year old children who have not yet been vaccinated and are eligible now, we will have that opportunity for the entire community. I know I'm going to get it, and I'm sure that members of the team are going to get it, because it is something that we need to start focusing on. If Omicron is the dominant subvariant in the country, and these vaccines can give you at least a 6 month protection against getting the virus or getting severely ill from the virus, I don't understand why anybody would feel like they don't, if they've already gotten vaccinated, why they wouldn't want to get the booster. But again, that is your choice. But we just want to make sure that you're educated about what is available, why it's available, and when you're going to be able to get it. So as soon as we get word that the CDC has approved this booster, we will definitely start advertising a date and time, and probably multiple dates and times, because we're talking about a lot of people that are probably going to want to get the booster, to have folks come out and get vaccinated with that new booster that's supposed to give you a lot more protection than the one that's already out. So that is what I wanted to talk about vaccinations and the news. And I'm going to open up the floor to any of the team that might want to add anything else about COVID. And if you don't have anything about COVID, then we can move on to the department updates.
I don't have anything to share.
Okay. Well, as we move forward, I just want to, we always leave we always have this COVID safe practice, the screen up, because, the blast that goes out, it always says, continue to engage in COVID safe practices to make sure you try to prevent the spread of COVID-19 in the community. And some folks are like, what do you mean by COVID safe practices? Well, um, uh, these are what we're referring to. If you're not vaccinated, you should get vaccinated. If you haven't been boosted, you should get boosted. Wash your hands often and avoid touching your eyes, nose, and mouth, because the virus does live on solid surfaces, and you can actually touch the solid surfaces like the table or whatever, and put it in your mouth and nose, which are primary methods that the virus enters your system. So you want to wash your hands so you don't pass it on to someone else, or you don't pick up someone else's virus that they sneezed or coughed out and put it in your eyes, nose, or mouth. Cover your coughs and sneezes so that if you are infected, you're not passing it on to anyone else. If you are sick, stay home. Avoid close contact with others who are sick because you don't know if it's COVID or not. It could be the flu. You still don't want to get that either because flu is bad too, right? Common colds are bad. All these different respiratory illnesses that we have been covered up and protected from the last 2.5 years are a lot more prominent in the community and society now because it hasn't it's we don't have a lot of protections from it because we've been covered up with masks and isolated, things like that. So you don't want to put yourself in a position where you're going to get sick from any of those things. Um, Practice social distancing by putting at least 6 feet of distance between yourself and other people. If there are people that are coughing and sneezing, that 6 feet is not enough. You need to be a little bit further away from them because coughing and sneezing can throw um, respiratory droplets up to 12 feet in front of you. So if people are coughing and sneezing, you probably want to avoid being in the room with them in general. But if you have to be in a room with them, be a little bit more than 6 feet away from them to keep yourself from getting exposed. Wear a mask or a cloth face covering. If you are in places where there are a large gathering or if you are sick, wear a mask. If you have COVID, even if you are mildly symptomatic or not symptomatic at all, many times, you can still spread that to other people in a room with them. So wear a mask. And clean and disinfect frequently touched areas. This goes back to that whole, picking up virus from solid surfaces. If you clean and disinfect often and well, even if somebody is coughing and sneezing, if you're wiping those areas off with disinfectant, you're keeping the virus from being on those surfaces where someone else can pick it up or you can pick it up and spread it to yourself or other people. So those are COVID safe practices that we generally talk about. Um, Lydia, just to answer your question, the booster is for anybody. In fact, everybody, because the boosters that were being given before were boosters that were designed from the previous formula of the vaccine. So it was protecting you from the original strain and some of the strains that were coming afterwards. This booster that's coming out is specifically for Omicron. Well, let me back up. It is updated to include Omicron, even though it does still include the previous vaccine formula as well. But because it has Omicron in it, everybody should get it, not just those people who have not gotten boosters before. Everybody should get it. In fact, if it's been over four weeks since your last booster, you should still get it. And they're gonna issue guidelines and guidance about this in the future. But the this new booster is everybody who has been vaccinated, as long as you fit in the age group that it is approved for, you should get it because it doesn't matter whether you've been boosted or not. This booster is completely different from any other booster that's been issued since the beginning of the pandemic. So, hopefully that answers your question because it doesn't matter if you've received 1, 2, 3, 4 immunocompromised. If you receive 5, because there's some people that have gotten 5 shots because they're immunocompromised, they should still get this booster because it is specific for Omicron, specifically updated to address Omicron. Anybody have anything else before we move on to department updates? Or sorry, program updates?
This is in reference to program updates. I just wanted to inform the community that the cards or the for the farmers market are being processed at this time. There's been over 6,000 applicants. So we've received a couple of cards and I issued them out. And then one individual that sent her application on her own finally received hers. So there's a big backup on entering all the information into the computer. So I keep checking the mail every day to make sure that the cards aren't in, and as soon as they come in, I'll start issuing them out to the community as they come in. So I just wanted to inform the community that I'm working hard with the state to get them issued to the individuals that applied for the farmers market cards. Thank you.
I just noticed that the Facebook comments are not turned on. We have the wrong um, comment option there. So I don't know, Leanna, if you've seen that post the response that I just gave you. It actually just shows that it went to YouTube. So because for some reason Twitter is on there and not our Twitter page is on there and not the the other Facebook page. But anyway, so to answer your question, if you got Moderna, so the Pfizer, the 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 direction or directives or information that the CDC and the FDA have provided around mixing and matching the boosters that you get from um, for either vaccine option, except for the Novavax. So the new Novavax one that was approved a couple of months ago, that one is not yet approved for mixing and matching in the United States. It is in Europe and other countries, but it's not approved here in the United States to mix and match to give a booster if you've gotten um, Pfizer or Moderna. So if you got Moderna and you want to get the Omicron booster, just like in the previous recommendations that came out, you are allowed to get a Pfizer booster and mix and match, just like if you had Pfizer, you can get a Moderna booster. So, but if you want to stay true to Moderna and wait for Moderna and wait until October, you can do that as well. It's just that if you don't want to wait, Pfizer is still an option to get a booster because you can mix and match the Pfizer and the Moderna for booster shots as long as you fit in the age group that um, it is approved for. So hopefully that answers your question. All right, Darylyn, do you have anything from the CHW side from COVID?
No, I don't. Just that there's still, you can call the Santa Fe service unit to schedule if you want your child vaccinated where they had approved for the 6-month-old to 5-year-olds. That's still going. So if anybody wants to get their child vaccinated in that age group, you can go ahead and call to schedule an appointment.
Thanks, Darylyn. Darylyn, do you remember the number, or Claudia, the number, so I can make sure I put that in the chat box is 946-9203. Is that what it is?
I believe so. I'll verify that. Hold on.
946-9203. Is that what you said?
Yeah, I thought that was
Yeah.
it. But, that's the Santa Fe service unit, and so that
Monday through Friday, 8 to 4:30.
and that's the COVID hotline, right? You can call that for questions about COVID as well, or if you need to get tested or want a PCR test, you can call that number to get a hold of the Santa Fe service unit around anything COVID related. But you can call there to schedule your vaccinations at the Santa Fe service unit. Now, just so you know, they are offering vaccinations at the Santa Clara location as well. So you can call Santa Clara, but theirs is limited to certain days. I think it's Wednesday.
Wednesday mornings.
If you want to go to Santa Clara instead of going to Santa Fe, you can just contact the Santa Clara clinic to get your vaccination scheduled. LaDon, you have anything?
Hi, everyone. Can you hear me okay?
Yes.
Can't hear you. Did they say yes?
We're here. We can hear you.
Okay, great. All right. I have a few things that I have a list of things. So first of all, I probably should share the Healthy Kids, Healthy Community events that are taking place, the Walking Wednesdays that will start in September. Um, Victoria is not here. She did share some information with me, but in light of National Child Obesity Awareness Month, she implemented a Walking Wednesdays. So that's going to start September 7th at 7:30. And so the San Ildefonso Day School um, invites everyone to come join them. And they will have two meeting spots at the Tewa Center and the Black Mesa Housing. And if you have any questions, you can contact Victoria. And then also um, she'll have a family fun challenge for the month of September. And then for the updates that I have, we're planning an outdoor cooking event. This outdoor cooking event is for really the community of San Ildefonso, and it will take place at Reunity Farms on September 14th, and we'll have a bus leaving here. I've contacted a few individuals, and they are very excited to participate. And I would like to reach out or let the community know of this event. We would like a few more participants. We're capping off participants at 30 individuals, and you can reach out to me. A flyer will go out in the bulletin in September, but even before that, you can reach out and confirm. We will provide transportation if need be. Um, and this event is being put together or is being funded by Farm RX. And then also the instructor is um, from the Sprouting Kitchen. And so, yeah, I think that's one of the topics. And then I'll just put some information on about the month of September's health observance. So going forward, I would like to try to put together a piece on whole grains. It's whole grains month, and hopefully I'll be able to put together a type of specialty baking class that will invite the community to participate in. So we want to take a look at the importance of whole grains and then possibly preparing some items from whole grain products. I'll keep you updated. I'm still working on that. Have a few more days, and they'll be put out in the newsletter for September. It looks like we have a question. What time for the Reunity Farms outdoor cooking event? That will take place at 4:30. The bus or the vans will leave from here at 3:45. So reach out to me if you're interested. We'll take a few more participants. That's all I have.
Thank you, LaDon. I also I'm just going to put this up on the screen because this is going to be in the bulletin, but it's information about the Walking Wednesday and the National Child Obesity Awareness. So this is just answering the question about the Walking Wednesday. If that's what your question was, Leanna, about the walk, it's starting September 7th at 7:30 in the morning, ending October 12th. That's just for that. And I don't. Did you put out a flyer for the Reunity Farms, LaDonna? Because I couldn't find it.
I'll share it with you.
Okay. And while she's doing that, I wanted to share this. If you are a Blue Cross Blue Shield, um, if you are a Blue Cross Blue Shield Centennial Care member, so if you're in Medicaid through Centennial Care, the Native American Advisory Board is having a meeting today, and they would like to have any tribal members who are members of their insurance company, to provide input on all things related to Blue Cross Blue Shield and what they are offering to Native Americans across the state of New Mexico. So the um, it starts in about 16 minutes. So it starts at noon, and it ends at 1:30. I'll put the login information um, uh, into the chat here in a second. But just so you know that if you are participating in the meeting, you can get a $20 gift card if you are a participant for the meeting. So I don't know how they determine that or get that information from you, but just wanted to make sure that you all are aware of it, because they contacted me yesterday and asked me to make sure that the community is aware of this activity, because they'd like as many participants as possible. And since it's last minute, I wanted to make sure that you were aware. And as possible, you can get 20 free dollars in the form of a gift card if you participate. So I think I fixed the link, by the way, because now it's posting to Facebook again. But it's there. Also, today at what time is the starts at 12:30, right, Ladon? The produce distribution.
The one under the big tree?
Yes.
Yes.
So at 12:30, you can go to the big tree. I believe that Thelma is on her way out to set up now. She is going to be out there providing distribution to families who have children in the community. So if you'd like to have some free produce, something that you can use to make food for this weekend or any other time, of course, go ahead and head out to the big tree, 12:30. It is going to be there today. It's like it is every Thursday. So you can go ahead and head out and pick up your produce if you'd like. And if you want to add any more to that, Ladon, since you're part of that process.
Sure, I can add to that. I just wanted to say that in looking at some of the CSA produce, the community supported agriculture, that's also provided by Farm RX. It's in collaboration with the New Mexico farmers. And so what they're doing is they're bringing in their produce and they're sharing it with the community. These items are locally grown, they're delicious. And one of the items I've seen that were provided is garlic. And garlic takes about 8 months to grow. It's a not a high commodity item, but I just wanted to share that little tidbit. So if you got garlic in any of your produce packages, just know that a lot of care went into producing that garlic. Usually garlic goes in in the fall, so just before the frost, and it stays in the ground, and then it gets harvested around June or July, and then it's provided to, or it's ready to eat. So it's a long process for some of the products that are available. So I feel like that's a really good program. It's no cost to the community. So I know that the criteria to get one of those community service produce bags is that it's for vulnerable groups. So you don't have to be a grandparent or a parent to a child. If you're a neighbor and you're feeding your neighborhood children, or just some of your babysitting and you're feeding some kids, neighborhood kids, then you can pick up one of those produce bags. So it's going to take place for a few more weeks, and those items, I believe, were only distributed about 20 bags. So first come, first serve. Once those bags are gone, then you got to wait till the following week, be there at 12:30. And yeah, Thelma stays out there till about 2-ish. for until all the products. That's all.
Thank you. Appreciate it. Go ahead, Claudia.
I just wanted to also remind the community that we are still walking on Tuesdays and Thursdays at 8:15 in the morning at the softball and baseball field. So I just wanted to remind people, the community. Thank you.
Thanks, Claudia. All right. It is down to the last few minutes. It's 11:50. We'd like to end a little bit early, so that individuals who would like to join uh, the meeting, the consultation for Blue Cross Blue Shield can. Again, the information's in the chat. Starts in 10 minutes. Also, we want to get to go to lunch because we always go over for some strange reason. But we're going to try to get everybody out of here on time. And go ahead, LaDon. Looks like you have something to say there.
I sent you the flyer to share for the outdoor cooking event.
I tried
If you can, that's okay.
to share it, but it doesn't. For some reason, this thing doesn't pick up PNG versions of images, which is quite strange. I've never seen that before. I tried to convert it to a JPEG, and it didn't work. So let me try one more thing here. I think we're going to convert it to a PDF so that I can make sure it goes, because PDFs always share.
That's strange because when I tried converting it, it doesn't give me the PDF option.
Well, I generally print a PDF because it makes it easier. Sometimes it works that way, and sometimes it doesn't. But it actually looks like it did it. So let me save this, and then I can put it up. That way, everybody can see the information on it. I mean, it's a good process. It's a good program. I think that the outdoor cooking class is going to be something the community will benefit from. I think it's going to be great for those people who are participating, and maybe when those of you who do participate, you can actually you can actually uh-oh, that's hilarious. Sorry, you can actually bring back information for the rest of the community. So the item converted, but only half the page. That is hilarious. Anyway, well, it looks like let me try one more time. That was weird. But if you want to talk a little bit more about it, LaDon, while I do this, I think that just kind of give people an idea of what the benefits of this
Sure,
process is.
I could do that. So what I did, usually when we announce here live, not everybody is able to receive the information, I've noticed. And I, in talking with Farm RX coordinator Kirsten, she'd mentioned that participation is a challenge when they put together outdoor cooking events. They've put this event together before, and the participation rate is really low. So in reaching out to them, I thought, well, we have a lot of community members who are willing and always looking for opportunities. Well, other options were to have it here in San Ildefonso. But since the instructor, she's a registered dietitian, Fallon Bader, is going to provide this service to us, I thought, why not just roll with what they've done before, what they're familiar with, and work with them. Reunity Farms is it's a farm, and so what happens is Fallon will take products right off the farm and bring them in the same day and have that provide that cooking instruction and nutrition instruction, nutrition education piece there. So I thought that was a better opportunity. It was a good opportunity. And one of the things that we could provide is really just transportation and then support. So this is really an event put together by this agency or this organization. If you're able to participate, it's a learning opportunity, and then it's also a good opportunity for Fallon and Kirsten to network with us. So I thought, it's a win-win situation, even for the clients, even for the participants. It's a good opportunity to learn, and then also have your lunch, feed your family, and then also meet new people, new faces, and new ways of preparing foods.
You want to talk about where the farm is located?
Uh, like I'd mentioned, I'm not familiar with Santa Fe. I can just, kind of give you an idea. The location is actually 1829 San Ysidro Crossing, Santa Fe, New Mexico. I'm not sure. I can't give you like landmarks of where it's at, but that's the address. I know that other events take place on the farm. They open it up to the community. We're lucky to get this location on the day that we requested. So that's September 14th. That's a Wednesday. Um, and yeah, that's all. That's the location. If anyone knows where it's at, somebody said it's you turn right at Burger King as you enter Santa Fe. That's all I know. Sorry.
It's off of Alameda in Santa Fe. But there's the flyer. I finally got it to convert into a PDF, so there it is on the screen. Leanne, I don't know if you're able to get a picture of that, but that's I can probably post it to Facebook, and you can get that. Um, be able to download it if you need to. So, but that's the flyer there. Um, I think it's a great opportunity, like I said before, not just to like like Ladon said, network and to feed the family and everything, but you don't see a lot of farms out there anymore like we used to, that you're able to go and visit and kind of get an understanding of how things work on a farm, that are outside the community. And this is just one of those opportunities that they don't come along very often. So people tend to enjoy this location, from what I understand. So um, have if you can, I don't know what the numbers are right now, that have signed up, but if they're taking up to 30 people, it's a great opportunity, I think. So again, we do have an opportunity to provide transportation for some, not all, if you need it. So if you'd like to get involved and participate, Ladon, if they contact you, or how do they sign up?
Give me your name, and the number of individuals who are going to participate, and stay in communication with me. And just, yeah.
There you go. All right, 11:57. Last call for any sort of comment or something you want to say to the community. Ladon, have anything? Darylyn
No, I don't have anything.
and Claudia.
Sorry. No, I don't have anything.
All right. Thank you all again. Appreciate your questions and your participation. And thank you to the team for helping to provide this update to the community. And we will see you all next week. Oh, I forgot. The 988 presentation is going to be, what day is it again? It is, I'm going to have to post that, but we do have a 988 presentation that's coming up here soon. So those,
September 8th.
September 8th.
so on September 8th, in the place of the update, we are actually going to have a presentation on the 988 crisis response number that was designed and created by the federal government to assist with those individuals who are in substance use, mental health, or other types of crisis that they're going to need assistance with. So stay tuned. September 8th, we will advertise it, of course. I think it's already been advertised on Facebook. So you can see that on the Facebook page if you are monitoring, or on the YouTube page if you're monitoring, because we did post it. I will send out a reminder so everybody's aware of it. But either way, we'll see you all next week. Have a good day.